Noong 2014, ang Pilipinas po ay nabansagang selfie capital ng mundo. At hindi po natin may tatanggi na napakahilig po nating magpa-picture. Basta may camera, tayo po ititigil at ngingiti. Matik po yan. It is instinctive and natural for all of us to smile. But there are times when kahit anong pilit hindi tayo mapapangiti. At ito ay kapag tayo ay bungal. Talagang hindi ka makangiti, hindi ka makapagsalita ng maayos at hindi ka makakain ng tama. At sa bansa natin na medyo mahilig magbiruan at mang-Alaska ang mga tao, hindi nakakaligtas sa mga bungal sa asaran ng mga magkakaibigan. Sa mga pelikula naman, silang kadalasan nagagamit na punchline o comic relief. Sa pelikula, maaaring nakakatawa. Pero sa totoong buhay, isa pong pasakit ang pagiging bungi o bungal. Mr. President, my dear colleagues, let me take a few minutes of your time to talk about the Filipinos' dental health concerns because dental health is no laughing matter. In a 2018 National Health Survey, it was confirmed that up to 73 Filipinos or 73 million Filipinos are suffering from dental caries or tooth decay. And just last February, the Philippine Dental Health Association announced that about 72% of our population has tooth decay. Mr. President, the Department of Health already said that this is a silent epidemic. I believe it is time to make noise on this public concern. While it is not deadly, dental caries is like a termite that slowly destroys our teeth and overall health, which, if not addressed, could lead to life-threatening diseases. How is this affecting our people? Mr. President, currently, 8 out of 10 Filipino children suffer from childhood tooth decay. And it's one of the leading reasons why children are absent from school. Also, madaming workers ang hindi makakapasok sa trabaho dahil sa pananakit ng ipin. Alam na po siguro natin lahat, pag ang ngipin po ay sumakit, isang ngipin lang po ay sumakit, buong katawan po natin apektado at hindi na po mapakinabangan. Apart from the extreme pain that toothache brings, studies have shown that gum disease, missing teeth, and other oral health issues brought about by poor brushing habits and lack of plaque removal increase a person's risk of stroke. Ito po hindi po ako nananakot. Those with overall poor health had increased damage to the architecture of their brain. Moreover, during the 2023 Internal Stroke Conference of the American Stroke Association, it was discussed that taking care of your teeth and gums improve your brain health. This is a serious health concern for our country, as declared by Dr. Manuel Ballesteros, the Department of Health's Division Chief for Disease Prevention and Control. To emphasize this, he cited how there was a case where a child with tooth decay developed meningitis. The child's pediatrician noted that the infection found in the molar and brain of the child were the same. At maliban sa epekto sa kalusugan ng ating mga kababayan, ang pagkakaroon ng sirang ngipin, pagkakabungi or bungal, at kawalan ng ngipin ay nakakaapekto sa mental health, self-confidence, at employability ng isang tao. Kapag ikaw po ay aplikante sa trabaho at ang posisyon na in-applyan mo halimbawa bilang isang sales lady, sales clerk, security guard, anything that has to do with dealing with people, malamang sa malamang, ikaw po ay hindi matatanggap. And despite the gravity of this problem and how it affects different aspects of our people's life, it seems that we have not done enough. At present, PhilHealth only covers oral surgery for patients confined in PhilHealth accredited hospitals. Limited surgeries lang po tulad ng tooth extraction o cleft lip o cleft palate surgeries. Hindi po kasama mga surgeries sa private dental clinics at hindi po kasama ang basic oral health care services. Ang proposal po na makausap ko sa Philippine Dental Association ay may isamang oral health care services na covered ng PhilHealth package. Mr. President, ang nais ko naman po sana mapag-aralan ay kung paano sana mabigyan ng dentures o libreng pustiso ang mga walang kakayanan na magpagawa ng pustiso. Mr. President, there is hope that at the moment for our people because according to PhilHealth, oral health care services will soon be part of the PhilHealth package under Universal Health Care Law. According to them, they are looking at implementing this within the year. And once implemented, Filipinos will be able to avail of basic oral health care services such as tooth filling, among others, in government health centers or hospitals for free. In light with this, I filed a resolution towards institutionalizing a stronger oral health care program. I hope to hear the side of PhilHealth on its financial capacity, the Philippine Dental Association on what is absolutely necessary for our people's welfare, as well as the DOH side on how best to implement this program. Mr. President, a strong policy and support from us here in Congress will have far-reaching effects for our people. I hope we can prioritize this to an appropriate legislation and eventually during our budget season. I hope we could fund this program accordingly. Again, thank you for your time, Mr. President. Good evening po sa inyong lahat.
Maraming salamat, Senator Raffy, sa inyong speech, privileged speech. We'll ask of course, the Majority Leader.
Yes, Mr. President, just
referral.
a short manifestation. Oral diseases disproportionately affect the poor and socially advantaged members of our society. In fact, Mr. President, according to the World Health Organization or WHO, there is a very strong and consistent association between the socio-economic status and the prevalence and severity of oral diseases. In fact, Mr. President, according to DOH National Monitoring and Epidemiological Dental Survey, around 92.4% of Filipinos have tooth decay and 78% have gum diseases. And that is why we echo the sentiments of our good colleague, Senator Raffy Tulfo, that dental health services should be more accessible and available for all. And with that, Mr. President, I move that we refer the privileged speech of Senator Tulfo and the manifestations thereon to the Committee on Health and Demography. I so move, Mr. President.
There have been objection to the motion of Majority Floor Leader. Motion is approved. At alam mo, Majority Leader,
Yes.
yung alam niyo po, Senator Raffy, yung nakakamatay yung nakakapatay ng tao yung bulok ng ngipin, it goes up to the brain. There are cases na it actually and also promotes heart failure, heart attack, stroke. So may correlation yan yung
Yes.
dental health.
Yes.
Dental health.
Yes, Mr. President, our Senate President Pro Tem, Senator Lauren Legarda, is also seeking the floor. I move that she be recognized, Mr. President.
Yes, our Senate President Pro Tempore, Senator Lauren Legarda, who is looking 10 years younger always, every day.
So, 38 years old
Is
na lang po,
recognized.
Mr. President.
That's right.
But first of all, seriously, I would like to commend our esteemed colleague once again, Senator Tulfo, for bringing to our attention something very practical at the same time so urgent. Salamat, Senator Tulfo. Alam ba ho nyo na dati ang Department of Health sa kanilang budget, kaya nandito yung Chairman ng Finance at Chairman ng Health dati, na merong either Bureau of Dental Health or Dental Health Program. Panahon pa yan ng ERAP administration, siguro Estrada administration, siguro ako lang yata ang nandito sa Senado noong 1998. Meron ba akong kasamahan na nandito? So, pinapa-research ko ngayon. Okay, grade school pa raw si Chairman ng Finance, Senator Angara, pero maski grade 2 ka noon, Chairman ka ngayon ng Finance. Maari kaya natin malaman kung ano yung programa, or LBRMO can help us, programa ng gobyerno na ziniro ang budget or inabolish yung program. Because I know, because my dentist, my longtime dentist, who is a gum specialist, Dr. Rani Reyes, sabihin ko, sabi niya, matagal nang linalobby niya na ibalik please yung sa DOH budget para sa dental, sa oral care. Kaya tama-tama po yung inyong binanggit yan, ang tagal na sanang gusto kong banggitin, pero thank you for bringing it to our attention because we should bring back whatever program or bureau that was maybe inadvertently abolished or zero budget or very small budget. Because really, hindi dapat puro private lang. Paano na yung nasa barangay na malayo? Paano na sa bundok, pupunta pa sa poblasyon? Ilan ba, itignan natin, ilan ba ang publicly accessible dentist? Ilan yung sa pribadong sektor? Magkano kada service? Iba pa sa ngipin, iba pa sa gums. Tama po kayo, apektado sa ngipin ang puso. Apektado rin ang utak. Apektado ang psychological and mental health. And of course, personality development. So, I thank you for bringing this to our attention. But we must see, I hope somebody can answer me now. Perhaps Senator Angara or the LBRMO or the staff can look at the budget that was deleted, taken away, either by Congress, the Senate, or by government, the executive, by ignoring the importance of dental health. There was, I am certain, it was in 1990s where there used to be a program and eventually taken out with zero budget or a very small budget. But I join you, and at the proper time, we will reinstate the dental health budget under the Committee on Health with the permission of the chair of the Finance Committee and the vice chair of the Finance Committee handling the health budget, that's Senator Pia, who are sitting right here. I'm sure they agree. And it's not enough that we do medical missions, dental health, once in their lifetime. Ang nakakaawa mga tao nga sa probinsya, maski sa syudad, hindi lang to pang probinsya, Senator Tulfo, hanggang sa mga syudad, Metro Manila, pumunta ka sa barangay, parang pinakahuling prioridad ang ngipin or dental health ng mga tao dahil may ibang mga prioridad sila sa buhay para bigyan ng pagkain sa bawat hapagkainan. So, nagiging last priority ang ngipin na hindi nila alam nakakaapekto ng mula ulo hanggang talampakan. Kaya ako po'y suportado ninyo dyan, suportado ko po kayo at lalagyan natin ang public access for dental health, for oral health care. Thank you very much, Mr. President.
Yes, thank you.